Are you a mom who sometimes feels like there's not enough time in the day to tend to your own mental health and self-care? Well, listen up, because in today's video podcast, I'm going to be talking with Mary Catherine, also known as MC, a previous neonatal intensive nurse turned pediatric NP and now a mom of 2 young children. We are going to dive into all things motherhood, discussing holistic medicine and ways to avoid antibiotics, as well as caring for yourself and your own mental health, whatever that might look like. We even talk about some candid topics, including choosing yourself before your children. The challenges of the world today are different than those mothers faced many years ago. Our villages aren't as big, so listen in this conversation to know that you are not alone.
My name's Mary Catherine. I do go by both names, and then a lot of my friends call me MCs. I am a mom to 2 young kids, so I have a 4.5-year-old and a 2-year-old. My 4.5-year-old is a little girl, and then my 2-year-old is a little boy. We live in Louisville, Kentucky. I am a pediatric primary care nurse practitioner, so when I went back to school, I specialized in primary care because that was really my passion, like preventative health. And then I'm also a certified lactation counselor. I became certified in lactation after I started breastfeeding my daughter and realized that it takes a lot of work. So before I was a nurse practitioner, I was a registered nurse, and I worked in the PICU, the Pediatric Intensive Care Unit at a children's hospital here in town. And then before that, actually, I was a child life specialist. So I worked in the same pediatric hospital helping kids cope with medical procedures that they were undergoing while they were in the hospital. So all my background is pediatrics. I've never worked with adults, never had a passion to work with adults. It's always been kids.
So let's get into your sort of holistic focus. Tell me, why you started with this interest in holistic practice to begin with.
So I definitely try to incorporate a lot of holistic alternatives in practice because I feel like just in general in America, we really overprescribe, we overdiagnose, we throw medicine at things a lot instead of really trying to figure out what's going on. I think root cause has become kind of a buzzword in the holistic world, but I do feel like a lot of times modern healthcare just doesn't look for the root cause. They just want to put Band-Aids on symptoms. So I became really passionate about, lowering my toxic load, trying to switch over, ingredients and being conscious of all that when I was starting to get pregnant. We were fortunate we didn't have any fertility issues. We didn't have any problems, but I just was realizing everything that you touch and your makeup, your hair care, all that kind of, there's ingredients that can really alter how your lifestyle presents and kind of your health and wellness. So I just think that there are a lot of alternatives in medicine that can go along with Western medicine. I treat kids with antibiotics all the time. I treat kids with SSRIs all the time. I'm totally pro-Western medicine, but I think there's a lot of alternatives that we can try first. I think a good example that a lot of people are surprised by are ear infections.
I was going to bring that up.
Yeah. But I see ear infections, every week in practice. I had probably 2 or 3 yesterday alone. But almost 80% of ear infections actually clear on their own. So they don't always require antibiotics. And in Europe, the standard is to watch and wait for usually 72 hours. And so see how things progress and you treat the symptoms. The American Academy of Pediatrics has started to kind of adopt that philosophy, the watch and wait. And they have changed shorter durations for antibiotics from 10 days to 7 days. So we're getting on board here. But, I think that earache drops with belladonna in it really help earache pain almost more than ibuprofen. I think that garlic oil in the ear, as long as there's not a perforation or they don't have tubes, can really help clear because garlic is a natural antibiotic. And so there's a lot of things that we can try first and then go the Western medicine route. And most of the time it works. So that it's been cool to learn about that kind of stuff and kind of see it in practice as well.
Yeah. I want to back up. I love, the avoiding of antibiotics for ear infections, at least maybe 72 hours, and the alternatives and the fact that I never heard of belladonna. So that's really cool. Mm-hmm. But just to reiterate, kind of you have to look in the ear and make sure there's no perforation before doing that stuff, right?
Right. It is really important to have a baseline. So, a provider still needs to be looking in the ears and then, 3 days later coming back to look at the ears. So that can be kind of cumbersome and a lot of parents, if that just won't work, I'll say, okay, let me write the prescription. You hold on to it. call me in 3 days and let's see where we are. If they're still in a lot of pain or we're not making progress, okay, we'll start the antibiotic or things like that. So there's other ways around it too, but definitely having a baseline and having eyes on the child and like looking at the ear for an ear infection, for example, is important.
Yeah. I think, what you're fighting against with all of this American culture, throwing medicine at things, is kind of like a culture that we developed over maybe the last 10, 15 years. And now it's starting to switch and we're starting to see problems associated with that. Whereas, when I worked in urgent care in 2013, everyone was coming in demanding antibiotics and a solution to their cold or their kid's cough. And so to shift that mindset has taken so many years, and I still think it's probably just beginning. But I love that you're currently in practice, you're at the forefront of this, you can talk to the parents and sort of educate, and then not only your patients in your practice, because that's only so many a day that we could reach, but also online and on social media. And that's where you can really have a huge difference if you can get your videos, viewed and to the front of people's mind. My pediatrician, I have the otoscope at home. So of course I'm looking in the kid's ear every time he's like, my ear hurts, or tells his teacher we have to pick him up. And we'll go to the pediatrician because it's like Friday. It looked red, but there's no pus behind it. And I don't want to do antibiotics unless we get high fever screaming after 3 days, but it's Friday and they're doing what you're doing. And they're saying, okay, cool. I'll give you the script. Don't use it if you don't need it. And a lot of the times we don't pick it up. So that's super cool that, pediatricians and pediatric NPs, PAs are on the same page as both the parent and as a healthcare provider trying to decrease the use of antibiotics, especially in kids. So.
And I don't think that people realize how much antibiotics in the first year of life can alter things. I know that it increases your risk of asthma later in life because you're killing off good gut microbiome. It change a lot about the natural microbiome in your body when you're taking all these antibiotics. So it is really important to try to avoid them, but Western medicine is a beautiful thing and it's there for us when we need it and fixes a lot of problems as well.
Yeah. I mean, now we're seeing that the microbiome is tied to like genetics, right? And I don't know the ins and outs of that, but I've seen some studies saying that it can alter your genes and, developing other diseases later in life. So we know that's super important, but we also know that a child in pain who's learning to speak or can't hear, that will delay other issues too. So having the happy medium of both is really great instead of just throwing antibiotics, which in the urgent cares, I'm sure is still happening because people are going there and just kind of like, my kid's sick. They won't sleep. We haven't slept, So you started it during pregnancy, which I became a little bit more holistic during pregnancy, but it's hard. Like I tried to cut out soap, shampoos, lotions, and then just like stuff wasn't working that well. I didn't like the sense of it. And then you get all new frying pans, so you're not getting toxic levels there, and you try not to use plastic. It's so hard. Like all your breast pump parts have made of plastic. So I'm not trying as hard as I did when I was pregnant, and I was having some pregnancy losses too. But I think it's always there in my mind as this like low level anxiety that, we kind of need to do something. And as I start to see like my husband comes home with plastic plates for the kids from the dollar store and puts them in the dishwasher, I'm like, not doing that anymore. But it's just like little bits that you can do at a time because taking it all on is a lot.
It's overwhelming. I get a lot of messages about that too, about how people just feel so overwhelmed and then they're like taken over by, oh my gosh, I can't do all this or I can't afford all this. And it really is a slow process, just one step at a time. Our journey's been like over 5 years of slowly getting rid of, like we replaced all our pots and pans, and that was a slow process. And then like we've gotten rid of plastic in our kitchen. My daughter's teacher actually sent me a message and was like, we would really like to not use stainless steel because kids are swinging them and like hitting each other. So can you please send plastic water bottles? And I was like, I don't own plastic water bottles. That stuff matters to me. Yeah. It's important to me. So we're plastic free in the kitchen.
Yeah, just hard no. So I want to talk about your CBD stuff. I'm excited to hear about it. I'm very casually skeptical, I guess you will. I know there's a lot of marketing towards moms and people who suffer anxiety. And I could say I probably have like a low level baseline anxiety as a human being. And then as a mom, it goes higher. And then as a healthcare provider, especially someone who works in psych and sees these kids who are really suffering, it goes even higher. So I'm totally curious to hear what you have to say about CBD, how you got into it, what it's good for, how you use it.
Yeah. So I think first and foremost, like let's clear the elephant in the room that CBD is not weed. So CBD is not marijuana. I think a lot of people get confused by that. I was confused by that. I mean, really, when I was starting to look into using CBD, I didn't understand the differences. And I was looking into using CBD. So I dropped part-time at work after I got pregnant with my second. And so that left Bailey, my 4-year-old, was home with me a couple days a week. And then I had my second child, and then they both were home with me a couple days a week. And I was just losing my patience by like 10 a.m. I was just like getting frustrated with them, and like, we had the whole day left, and Trip was napping multiple times a day, and then Bailey was not napping, so she was not cooperating, just all the mom things. And I was like, I cannot do this. Like, I don't know how stay-at-home moms do this 24/7. I felt like I didn't need like 24/7 like medicine, like something like an SSRI or something. I didn't feel like I was to that point, but it was definitely something I was considering. And so I found CBD through research, and then started researching companies and like clean CBD, because that's a whole nother thing. And, we'll get into that too. But I found Green Compass and started using their products. Within a few weeks, I was feeling a lot more patient. Like the little things, if they spilled the kinetic sand all over the floor, I was just like, oh, well, darn, no biggie. Let's just clean it up together, instead of like, freaking out and like letting it completely destroy kinetic sand. I love kinetic sand because I think it's easy to clean up, but my husband hates it. Like,
I like to play with it, but they rip it apart into these little granules, and it's like,
But yeah, CBD has helped me a lot. So I'll kind of break down what CBD is, because it is a little confusing. So you have the cannabis plant, and that cannabis plant has different species. So you have marijuana that comes from the cannabis plant, and then you have hemp that comes from the cannabis plant. So I think the best way to my mind to think of it is, think of grapes. So you have a grapevine. So grapes can make wine, or grapes can make grape juice. So CBD and hemp is all the grape juice, and marijuana, THC, is all the wine. So I'm not talking about anything. CBD, hemp does not have any psychoactive effects at all. It does not get you high. You really don't even feel anything when you're taking CBD. It's more of what you don't feel. Like, you don't feel that anger starting to bubble up, or you don't feel that stress like kind of starting to take over. THC is a totally different compound. CBD has become really popular. I feel like everybody sees, these little like smoke shops and CBD stores on every edge of the corner, at least in my town. I know when we went to family vacation in Florida over the summer, like, you can see a CBD shop everywhere. Like, there's a lot of them. And so the reason for that is in 2018, the U.S. passed the Farm Bill, and that made CBD or hemp. So this all kind of became a new thing in 2018. So legally, CBD or hemp products have to contain less than 0.3% of THC in the entire product. So that's a really small amount of THC. Most companies have products that contain no THC, and then they have products that contain that small trivial amount of THC. So Green Compass, we call that broad spectrum, is what has no THC at all, and then full spectrum products have that small amount of THC.
So it has 0. Like, they can say for certain this is 0. And I've asked you this question before, but what about the drug testing? I mean, we're talking healthcare professionals, people who work in positions where if they get drug tested, they're going to lose their career, their job.
Absolutely. The actual number is it's undetectable up to 0.001%. So there is no THC that is at all detectable in broad spectrum products. That's what I use. So when I started taking CBD, I was still breastfeeding. My son was 10 months old, and we breastfed until he was 20 months old. I personally did not want any THC at all, not only because I'm a medical professional, but because I was nursing also. So yes, so you will not fail a drug test on broad spectrum products. So full spectrum products, which again has that really tiny amount of THC, can trigger a drug test. So that's always something that I'm talking about with people who are asking me about CBD. Are you pregnant? Are you nursing? Are you sensitive to THC? Or have you tried THC in the past and haven't had good outcomes? Or are you in a position where you're frequently drug tested for any reason? So if any of these answers are yes, I say, okay, full spectrum products will not be for you.
Ended up having to take fluconazole during my entire pregnancy with my first child after miscarriages, because I had valley fever. I had a fungal infection that I got from the soil in Arizona. And I talked to 3 infectious disease specialists, and they said, we don't know. It's not studied. It could cause problems, but the ultimate, and I was seeing a therapist at the time, and she said, you choose life yourself because you're the one who gives life to this child. So you have to keep your life healthy and you have to, stay alive in a sense. So, that makes the choice easy, right? When you weigh it against the potential issues your kid's going to suffer with if you're not okay and your mental health is not okay. So, I can see the conundrum there and people who don't want their kids getting any substances at all, it's got to be known that yes, some does cross it, but what are the other outcomes if you're not present or, able to engage and play the way you want to, or you're not sleeping. So
yeah, and I think
it's like a very individualized decision.
Right. And like you said, or what you were talking about with your therapist, where it's like, okay, you have to choose your health versus your, a baby that's growing in you, or even your children's health that are outside in the world. I think that just sums up motherhood. I mean, there's a lot on our plates. We're not our own person anymore once we become mothers, and we're constantly thinking about everybody else. And, this is like where we're not even talking about like the laundry and the carpool and the sports and activities and the, doctor's appointments and, that, like, I know husbands and dads totally share in a lot of the roles, especially these days as, a lot of people are working, both parents are working outside the home for a lot of families. And I personally have a very supportive husband and he helps tremendously. But at the end of the day, so much more falls on me because I'm mom. So our mental health is really important. And I think that in the world that we're living in with social media and like just, even with the world events right now, like we're exposed to everything. Our brains aren't made to have all this knowledge and to see all these things and to, be taking care of all these things. And like, we're not set up to have this much responsibility as the mom does in 2023. And so I just think that we all need help. Be it if it's therapists or if it's medicine or if it's alternative medicine or if it's just good friendships or, whatever it is, we all need support because it's a lot in this world right now.
Yeah, I couldn't agree more with you. You put it perfectly. I mean, even just as you're scrolling, I follow a lot of ER doctors, pediatric ER doctors, and one of them was on the other night just sort of in tears after a really bad case that went wrong with a child and child passed, and then taking the load, because she has an infant too, of how you would ever describe what's going on in the world to our children in a way that they feel safe. And then furthermore, what happens on the news and then seeing the children that are in the midst of all of this, it's such a heavy load. I can tell you, a nearly 4-year-old crawled into bed with us last night, and that's fine. I love snuggling with him. He doesn't do it all the time. But by 2 a.m., I was like, okay, we should go back to your bed so you don't wake up early. And I carried him back, and you're carrying him like this, right? Like a baby, and his head's sort of like that out. And I was in my sleepy state, and I just had this image that I had seen on the news of the doctors carrying the children from the hospital that was bombed like that to a stretcher where they were put with 5 other children on the stretcher. And I, felt that so deeply as I was able to like put my child in his cozy bed and know that he was safe. So, I mean, it's just a lot right now for anybody. And I think you're right when you say whatever it is that you need to help your mental health, whether it's friends, exercise, medication, therapy, hugs, whatever, maybe CBD, then you have to figure out a way to do it in a safe way that you can still be present and available for your children, your family, and sort of cope with.
Yeah, absolutely. I mean, it's heavy. My son was protesting bedtime a few nights ago and was insisting on being held. And I was like, okay, I'm going to sit here and hold you. And, just had like silent tears running down my face because I was like, I can sit here and hold you. Yeah. So I totally relate to your story too.
There's so much to that. And it's just interesting that I'm hearing it from moms, and we're kind of silent about it, but there's a guilt associated that we're okay for the moment. And that our children are safe for the moment and the time being now. And there are other children that aren't. And, what can you do? And so there's just a lot of divided, conflicting emotions, which is motherhood in general, but maybe extra intense now.
As a healthcare mom, like exactly what, that ER doctor went through, as healthcare, as people working in healthcare, we see a lot of things, and we are exposed to a lot of emotions. And, I can remember shifts in the PICU where we would have, a baby pass or a child pass. And it's like, you have to do that, and then you have to go on and take care of your other patient, or you have 6 hours left in your shift, and then you have to go home, and that's a lot too. Moms in healthcare, dads in health, parents in healthcare, that's a whole nother level of things too. And that was a big reason why I switched out of the ICU, because I knew that I didn't want to carry that burden. So I applaud parents who can do their job and separate it enough to be good at their job, and then go home and be the parent too, because that's a lot.
I left hospital medicine because of that burden. It wasn't in pediatrics because I was doing adult hospital medicine, but diagnosing new cancers and giving life prognoses that are less than a year, less than 6 months to someone who had no expectation. That's what you're going to find. Day in, day out was too much. And again, I agree with you. I applaud everyone who can do that, but I wasn't going to be able to do that long term. Now in a psych hospital, there's one adolescent unit, and the stories that we just are kind of naive to, human trafficking, abuse, neglect, foster system, CPS cases. I mean, I am just learning that there is so much pain and suffering in our world that we may think is safe, and we're not in a war right now in our area, but there's a lot. And when I talk with those children, 12, 11 years old, you have to pause after those visits, and it sticks with you all day. And then you come home and you see your children, you say, what can I do so they don't experience this type of pain ever? And is it something that I can fully prevent? And usually the answer is no, I can do the best I can. But that responsibility, again, falls on us as parents. And as parents in healthcare, moms and dads, we see the alternative and the other side of what could be. So like carrying that with you all the time is a lot. And I know that sometimes I am super anxious when the kids are doing just dangerous things, running around, God knows what. I mean, they both fell and hit their noses this morning before 7:30 in the morning. And, my husband will turn to me and be like, chill out. And I'd be like, oh, it's so hard. It's so hard to chill out. He's like, I can feel your anxiety. I'm like, me too.
Yeah, so I know it's hard. And I feel like as healthcare parents, a lot of times I'm like either hyper reactive to the situation because I know what it could be or what it could become, or I'm like, you're fine because I know what it isn't. But
yeah, it's either or. That
I really appreciate you reaching out and asking to do this. I think it's a really cool avenue that I haven't done from social media. So, and I don't see another account like yours. I think it's really awesome. So definitely keep it up.
There's just such a sense that I can only reach so many patients a day in clinic or in the hospital, and it's not enough. You can work as much as you want, and you're still not going to have an impact. So to be able to reach on social media is huge. And then even furthermore, because I'm in psych, I'm seeing all these moms, and they have mental health problems, and dads, and they don't have access to pediatricians. They don't have access to healthcare. They don't have insurance, and they have lots of kids, and the kids suffer because they don't have information, and they get all their information from TikTok. And so why can't we just put it out there and just kind of drown out the noise that is the bad information? So I love what you're doing. I love your platform. I love that it's growing. And, that's kind of a common goal. And I hope, in the future, all this stuff is just going to be so much more accessible to anybody, even people who can't afford healthcare.
Yeah, I totally agree.